lovelies, you are welcome back to Where Your Health Matters with Elizabeth. You know how we roll on this channel. We are all about taking care of your health, living an healthy life. If you have one or two diseases, how you manage it with what you eat, nutrition. Basically, that's what we do on this channel. On today's episode of Where Your Health Matters, we'll be looking at a very interesting topic. A topic that most people don't really like. Some see it as a serious case, and some are ignorant of it. You might have heard of it before, you might not have heard of it. This might be your first time hearing about this topic that we're talking about today. This topic that we're talking about today is no other than amenorrhea. Yes, amenorrhea. You might have heard of it before. This might be your first time. Don't worry. Just sit back, relax. Make sure you watch this video to the end. We're giving you everything that you need to know about it, every little tips that you need to know about it, and you can also manage it with nutrition, your diet, what you eat, basically. So sit back, relax. You can get your jotter, your pen, and you can also keep it to your brain, So just sit back and let's dive into it quickly. Amenorrhea is a condition that affects mostly women. It affects women basically. It's a condition whereby you miss your period. It's also a term that is used for missing period. That is, you didn't see your period at all. You've never seen your period before. You've been seeing your period before, and suddenly you didn't just see it. That's the term used for it. Amenorrhea is of two different kinds. It can be primary amenorrhea and it can be secondary amenorrhea. Primary amenorrhea occurs when someone of puberty stage, a lady that is already of puberty stage, that is of age of getting their period, they are already 15 and they are not yet seeing their period. That is what they call primary amenorrhea. You are age 15 above, you've not seen your period, you are experiencing primary amenorrhea. While secondary amenorrhea occurs when you've seen your period before, just suddenly you're not seeing it again, and you're not seeing it for months, 3 months, 6 months, and you're not pregnant. That is secondary amenorrhea. Primary amenorrhea is when you've not gotten your period like you've not gotten your first period after the age of 15. You're 15 already, you've not gotten your first period. 5 years after, or within 5 years after reaching puberty stage, that is growing breast, growing armpits, you've not seen your period 5 years after that, you're experiencing primary amenorrhea. It can be due to some factors like genetics. It can be due to acquired abnormalities. While secondary amenorrhea is when you're not getting your regular period. Your period just stopped. You're not getting it. You've seen your first period, you've been seeing your period, suddenly it just stopped. You didn't see it for months. It can be due to some reasons like pregnancy, lactation, stress, anxieties, you're having chronic illness. Some birth control methods like IUD, intrauterine devices, and certain birth control pills can also cause amenorrhea. If you've done uterine surgery before, this can also lead to amenorrhea. Chemotherapy and radiation for cancer patients can also lead to amenorrhea. Stress is a big factor in amenorrhea because poor nutrition, weight changes when you experience extreme weight loss or extreme weight gain. Extreme exercise method, if you are the type that do strenuous exercise, can also lead to you having amenorrhea. So medical condition can also lead to it, like primary ovarian insufficiency. That is when your ovary stops before you are age 40. It can lead to amenorrhea. Obesity, ovarian tumor, like if you are experiencing some chronic diseases like the kidney disease, inflammatory bowel disease, can lead to you having amenorrhea. There are some certain risk factors you have to look out for too. Family history of amenorrhea or early menopause. If you have somebody in your family that experiences such, it's likely you also experience it because amenorrhea is actually genetics. Obesity or being underweight eating disorder, stress, over-exercising, poor diet, they are a huge risk factor to amenorrhea. Even though amenorrhea is not life-threatening, but the causes of amenorrhea can lead to some certain complications like osteoporosis. It can lead to infertility and it can lead to pelvic pain. How do you diagnose amenorrhea? You have to first off meet with your medical practitioner for accurate diagnosis. But there are some tips here that you can follow up to get to know if you have amenorrhea, and also make sure you visit your doctor to be sure. One, you use an app or a journal to be able to take note of how your menstruation is like, especially for those experiencing secondary amenorrhea. You can download an app on your phone. There are several apps for menstruation. You can download like my flow app, my calendar, flow app. There are several apps on Apple Store or Play Store. Download it, or you get a journal. You can download it. Get a journal. You take note of how long your period lasts. You take note of when last you have your period, the medication you use whenever you're taking your period, especially for those that go through menstrual cramps, the changes in your diet or exercise routine, your emotional challenges you have in such as stress. Make sure you take note of everything. Whenever you have your last period, you write it down. If you do not see it the next month, you write it down so you'll be able to know accurately how many months you've missed your period, how irregular your period is, so you'll be able to know what you tell your doctor when they ask them questions. Your doctor will be able to diagnose it. The nutritional management of amenorrhea. This focuses on addressing the underlying causes, which are nutritional deficiency, hormonal imbalance, energy availability. So there are some approaches you follow up to manage these underlying causes. You ensure you take in adequate calorie. Increase your intake of nutrient-dense foods like your whole grains, your lean protein, your healthy fats, your fruit and vegetable. You make sure you balance all your micronutrients. You balance your protein intake, your healthy fats, your complex carbohydrates. Balance them. Avoid extreme calorie restriction. Avoid it. Don't go and be fasting anyhow. You correct your nutritional deficiency like your calcium deficiency, your vitamin D deficiency, your iron deficiency. Though iron is common in heavy exerciser, you make sure you increase your intake of red meat, beans, spinach. They are rich sources of iron. You increase your intake of vitamin B12 and folate. It can be found in your animal products, your fortified cereals, your leafy greens. Your zinc and magnesium is very important also because they support hormone functions and menstrual cycle regulation. It can be found in nuts and seeds, your dark chocolate, they are rich source of zinc and magnesium, your legumes. Also, you manage your blood sugar and insulin level. If amenorrhea is due to PCOS or insulin resistance, you consume low glycemic index foods, fiber-rich meals, and avoid excessive refined carbohydrates. You also stay hydrated. It is very important. You drink enough water to support your metabolism and hormone function. Some herbal teas can also help you to hormone balance. Modify your lifestyle. Reduce stress. Chronic stress affects cortisol level, which can suppress reproductive hormones. Exercise moderately. Excessive exercise can lead to hypothalamic amenorrhea. So balancing workouts with rest is the key. Is the master key. Get adequate sleeps. Sleep helps to regulate your hormones like the melatonin, your leptin, and the cortisol. It is very important to consider all this, and also you seek professional help. You can visit your nutritionist, your dietitian, your doctor, your gynecologist. They will put you through the necessary guidelines you have to follow in experiencing amenorrhea. you didn't see your period for long, you didn't see your period 1 month, 2 months, 3 months, 6 months, and you're not pregnant, and you're looking at it, you'll be like, thank God I'm not going through this. Especially those that have menstrual cramps, they'll be so happy that they did not see their period. You are doing yourself, you are killing yourself. Not seeing your period can lead to infertility. You've not given birth to all the children that you want to give birth to in this world. And you're not seeing your period and you're happy. You're not in your menopause era. You're not pregnant. You are not breastfeeding. It's not see your period and you're happy with it. Please go and see your medical practitioner. Follow all these nutritional guidelines. If all these did not work out for you, go and see your doctor. He'll give you the actual, the necessary, the accurate tips to take care of your health. Not experiencing menorrhea, you don't want to experience it. You can also prevent it by following a diet or exercise plan that is healthy for you. Be aware of your menstrual cycle. Get regular gynecological appointments, including having a pelvic exercise, having a pelvic exam and palm test. Get regular and adequate sleep. Stop stressing yourself. This life is too short. Limit your stress. Don't do strenuous exercise if you do not want to experience menorrhea. Menorrhea, as simple as that can be, as minutely you think it is, it is. And it's a wrap for today. We look at what menorrhea is all about, how you can manage it with your diet. So please don't forget to subscribe, like, share to your friend, talk to your friend about this channel, tell your friend to tell your friend. Subscribe. Your subscription is very important. Comment if you have any question at all, send it to the comment section. I'll be willing and eager to attend to all your question. Thank you so much. Thank you for the love. Thank you for watching. See you next time. Bye bye. Love you.